Advances in minimally invasive surgery are fueling the growth of office-based outpatient procedures. The Philips Veradius Unity mobile C-arm with flat detector is the center of that experience.
We're a full-service interventional cardiology practice. We're situated in Tuscaloosa, Alabama. Most of our peripheral procedures are done here in the office-based lab. That consists of both venous and arterial procedures, primarily lower extremity, some renal interventions, and some diagnostic peripheral interventions. One of my greatest concerns was being able to deliver a quality product in an office-based setting. I'm very used to and was trained on a fixed unit in a hospital setting. I was only going to do this adventure if we could guarantee that the imaging would be equivalent to what we could get in the hospital. I think the driving force in getting us to choose the Veradius was the partnership with Philips and the support that we received. Probably the most important feature is the small footprint and its ability to deliver superior image quality. The user interface is exceptional in that I alone can make some changes to the exam without having to instruct anybody else, which allows me to get exactly what I want. And as an interventional cardiologist, I'm fairly particular. So one of the neat things about this particular unit is the ease with which it can be moved and the ease with which the angles can be changed. One of the really neat features is the memory feature, where once you find that particular angle and you're able to get a certain position, you can save that angle and then come back to it later after you check it in another angle. The color-coded locks are very unique to this system, and it allows us to communicate better within the team for better positioning in terms of viewing imaging. And outlining the vessels themselves and the branches allows for me to more quickly and more accurately locate them, and I can actually do that myself. In order to make an office-based lab work, you have to be efficient. And this unit has been remarkable in allowing us to do that. That starts from the small footprint allowing us to move the patient into the room, having the C-arm out of the way in a confined space. And then it also starts with the patient input. The unit, in terms of putting the name and patient information in, is a very easy system. It has several different presets, and the interface in terms of the flat panel screen allows me to basically touch one or two buttons and get the images that I need. We have our convenient remote placed on this particular part of the C-arm where I can access, replay the images from before, move them forward and backward. The shuttering is easy to manipulate. You can have individual shutters that you can move in and out as you would like, which again allows for better image quality. And at the end of the case, we are able to typically, with a single user, remove the C-arm out of the way, get the patient off the table in an expeditious manner, then export the information to our PACS system and our EMR very easily. Just yesterday, we treated a patient who came in with lower left leg ischemia, and it was very important that there was one single vessel runoff that had a very tortuous takeoff, and it was the ability for the Veradius C-arm to be manipulated to a certain angle and provide excellent image quality for us to be able to wire this vessel and in turn balloon and do an atherectomy there, which essentially provided the blood flow that her leg needed to keep her foot. Through a partnership with Philips, we were able to develop the lab here and develop care that we felt to be equivalent or superior to what we could deliver at the hospital on a much more timely basis, allowing me to be more efficient and allowing the patients to have a better experience.
Innovation and you, Philips.